November is Diabetes Awareness Month. TGMC would like to raise awareness in the community of this condition, the different types, its symptoms, and manageability.
All right, joining us now is Dr. Samir Kalani, and welcome to the program. Good to have you back.
Thank you. Good to be here.
Yeah, it's been a while, but you look great. You're doing great. So everything's okay, huh?
Well, thank you. Good to be back.
So we got a few questions for you. Let's first of all start off with just a basic. What is diabetes? A lot of people have it. So what is it? Explain it to me.
Diabetes is what we call a disorder of metabolism, and which is the way that the body uses digested food for energy. Most food that we eat gets broken down into simple sugars or glucose, and after digestion, glucose will need to move into the bloodstream, transported into the cells where it gets in and be used for energy. But for glucose to do that, it needs insulin. Insulin opens the gates and glucose then moves into the cells for energy. When people eat, the pancreas automatically produces the exact amount of insulin that's required to do this job. In people with diabetes, however, the pancreas either does not produce enough insulin or the cells do not respond to the insulin the way that they're supposed to. And as a result, the glucose will then start rising in the bloodstream, it will spill into the urine, and it will pass out of the body and will get lost. So the major feature of diabetes is elevated blood sugar, and over time that leads to some serious damage.
Okay.
What are, we know there are several different types of diabetes. Can you educate us on that?
Yeah, there are basically three major types of diabetes. Diabetes type 1 is characterized by deficient insulin production, and those patients were required to take insulin injection all the time. And it can happen at any age, but mostly it is still a disease of children and young adults. Then there is type 2, which is the most common type of diabetes. That's 90% or so of diabetes is type 2. And this is the type of diabetes that is characterized by the body's ineffective use of insulin, or what we call insulin resistance. This is a type that's associated with excess body weight, obesity, lack of physical activity. And until recently, it's been mostly seen in adults, but lately we've been seeing it more and more in young children at alarming rates, I may add. The third major type is what we call gestational diabetes, and this is the type of diabetes that happens or is first detected during pregnancy and typically goes away after childbirth.
Okay. Now, what causes diabetes? I mean, if you had to break it down to the causes, what would they be?
It depends on the type. Type 1 is mostly thought to be an autoimmune phenomenon. So that's where the body's defense mechanism actually attacks the insulin-producing cells in the pancreas. And the reason why that happens is not fully understood at this time. Most likely there's a combination of genetic factors and environmental factors that take care of that. Type 2, on the other hand, is associated with obesity, lack of physical activity, and that's when the body cannot use insulin properly. We know that there are certain factors that would lead to that. Older age does, inactivity does. Certain racial and ethnic groups will have a higher propensity to develop diabetes type 2. And again, the exact reason why this really happens is not fully understood. We seem to believe that there are both genetic and environmental factors as well. For gestational diabetes, the reason why that happens is that the same normal pregnancy hormones that are secreted by the placenta, those same hormones actually act to make the body more insulin resistant. Luckily, for most patients, for most pregnant women, the body will adapt and the pancreas will produce enough extra insulin to overcome that resistance. But about 3 to 8% of pregnancies end up with gestational diabetes because of that. Luckily, this type of diabetes goes away after pregnancy, but it may come back as a type 2 diabetes later on.
Okay.
Cool. What are some of the symptoms that people should look out for?
Yeah, this is a very good question. People may have different kinds of warning signs and symptoms, but it's important also to realize that sometimes there might be very few symptoms or no symptoms at all, and that's what led people to call diabetes a silent killer in a sense. But some of the common symptoms are increased thirst, frequent urination, extreme hunger, unexplained weight loss, fatigue, tingling sensation or numbness in the hand and feet, and so on, slow healing of the sores, blood pressure elevation, frequent infections, and so on. It's important to note, though, that these symptoms are so nonspecific. So you can have these symptoms and not have diabetes. You can have these symptoms for other reason. But if those symptoms are present in the right setup, I think that should raise enough suspicion and concern for the patient to be tested.
And before we go to break, can you have one or two of them and not all of them, or do you normally get all of them?
Not necessarily. There's a variation. You can have one, more than one, or none at all.
All right, what we're going to do, we'll take a break. We'll come right back talking to Dr. Kalani about diabetes. Don't go away.
Terrebonne General and Mary Bird Perkins Cancer Center bring a new standard of high-quality, comprehensive cancer treatment to our community, now in one convenient location in Houma, bringing together world-class technology and a caring and healing environment to provide the best patient experience possible. Our new cancer center was built for you because we care for you. Mary Bird Perkins Cancer Center at TGMC, Houma.
All right, Martin Falls, Shawnee Burgard. We're talking with Dr. Kalani, Samir Kalani, about diabetes. And we had a few questions, but how do you test for diabetes?
Martin, there are several ways to test for diabetes. The easiest one is a urine test. That's where we get those sticks that have a chemical reagent. You dip the stick in the urine and it can detect the presence of sugar. The more precise ways of testing for diabetes, though, are four. There is a fasting blood glucose, which is a blood sugar that you test after an 8-hour fast. There is a random blood sugar that can be taken at any time. The newest test is what we call a glycated hemoglobin, or the A1C test, which is a test that gives you an approximation of what the average blood sugar has been in the preceding 2 to 3 months. This is the newest technology, and that's probably one of the best ways to test for diabetes these days. And there are some ranges and some numbers that the American Diabetes Association has developed that will tell you that a fasting blood sugar of this level or higher is definitely diagnostic of diabetes.
Okay.
Who should be tested for diabetes, especially here in South Louisiana?
Anyone with symptoms that could be suggestive of diabetes deserves to be tested, and that's true for diabetes or for any other medical condition. If you have symptoms suggestive of the condition, you need to be tested. Now, the issue of testing for diabetes in someone who's completely asymptomatic is a different issue. That's what we call screening. And the American Diabetes Association actually has weighed in on the subject and has recommended the following. They recommended that we screen for type 2 diabetes in people who are asymptomatic at any age, if they are overweight or obese, plus if they have any additional risk factor for diabetes. And these are the risk factors that they talk about: physical inactivity, first degree relative with diabetes, so a brother, a sister, a mom, a dad, high-risk race or ethnicities, and essentially those are the minority groups. African Americans are a high risk, Hispanics are a high risk, Native Americans are a high risk, and so on. Women who had big babies over 9 pounds are a high risk. Hypertension, high blood pressure is a high risk. Women with polycystic ovarian syndrome is a high risk. The presence of any of these risk factors in a patient who is overweight or obese is an automatic cause for concern and probably warrants to have the patient tested for diabetes.
Yeah, one of the more important questions, I guess, would be how do you treat it?
It's important to know that before we discovered insulin back in 1921, almost everybody with type 1 diabetes died within a few years of the diagnosis. We have come a long way. Insulin is not a cure for diabetes, but its discovery was the first major breakthrough in diabetes treatment. There are different ways of treating diabetes, and it all depends on the type of diabetes and the severity. The common themes are the following: healthy eating and regular physical activity is something that is essential for every diabetic patient to undertake. In addition to that, there might be some pharmacological intervention in terms of medication, pills, injectable, including insulin, and so on. But that tells only a part of the story because people with diabetes really must take responsibility for their day-to-day care, which involves not only taking their medication, but blood sugar checking frequently, keeping logs of that, keeping their appointments with their care provider, whether that be their primary care physician or a specialist like myself. They need to be compliant with the diet, being active, their appointments, checking their eyes with the eye doctor, and so on. It's a lot, and I'm the first one to admit that. And most experts would agree that to empower the patient and to allow diabetic patients to be able to do that, they need to be intensively counseled and educated about their condition and how to effectively control it. And a process that we call diabetes self-management education, and that is usually run by a certified diabetes educator and a registered dietitian. And we are blessed here in Homa to have a center that can provide that at TGMC.
Okay.
Are some people more at risk to diabetes than others?
Yes, as we said, usually it's overweight or obese patients or patients who have a strong family history of diabetes in relatives, people who are inactive, people of certain ethnic and racial makeup, the minorities, as I mentioned earlier. All that increases your risk of having diabetes. And finally, one final word I may add, that the reason why we worry about diabetes is that it is very common, very prevalent. 2 million new cases diagnosed last year in the United States alone. And it carries a large burden of serious health consequences in terms of cardiac problems, eye problems, kidney problems, and what have you.
And what we'll do, we'll put on the screen now for more information. And if you want to learn more about diabetes, there you have it right there. You can visit TGMC online at tgmc.com or call the number 850-6200. Dr. Kalani, thank you so much for coming on tonight. Very interesting.
My pleasure.
Thank
My
you.
pleasure.
All right, what we'll do, we'll take a break. When we come back, we have Nicholls State University, and then we have sports, so don't go away.